Good evening and welcome to the September 8th, 2022 meeting of the Fitchburg Board of Health. I now call this meeting to order. Please be advised that FATV is conducting an audio and video recording of this meeting for public broadcast. I ask that anyone else in the audience who is recording this meeting please identify him or herself for the record now by standing and stating his or her name and address. Is anyone else recording? No. I think then could just go right straight into our agenda. The first on the agenda is a moment of silence for the Leominster Director of the Board of Health, Jeffrey P. Stevens, who passed away recently, having lived from 1971 through 2022. So I just request a moment of silence in honor of his service. And again, thanks to Mr. Stevens for the work that he did on behalf of Leominster and for all of us in central Massachusetts. I think that I won't read the requirements for standing and speaking since everyone here seems to be on staff and we don't have any outside petitioners today. So I think the next item on the agenda would be a report from the Food Inspection Division from Sean Michael Tentinnerwat. Get that right? Food and Milk Inspector. Afternoon.
Afternoon, everybody. So yes, I've been working for the city of Fitchburg since January 3rd now. I've inspected 233 of the establishments. We only have 197. So I'm on my second wave of their second inspection for the year. Complaints have been going down. We started off around 4 average in the beginning of the year, and now we're about to 2 to 0. This month we have 0, so that's really good. We have quite a few restaurants coming in, if some have already opened. We have Roasted on John Fitch Highway. We have Delicious Dips on Franklin Street, Malau on Airport Road, and then we have The Cellar, which is on Mill Street. We have several food trucks as well. We have El Sabor del Lola, which is off of Lunenburg Street, and El Diente Boricua, which is off of Water Street. And then Jay's Italian Ice, which can be found at the Farmers Market and occasionally at the Fitchburg Parks. We have a couple of swap outs with owners, Macario's Kitchen, Mike's Pizza, and Kiki's Kitchen. The same concept will be staying there. And then we have another swap out at Fitchburg Diner. And a couple other coming restaurants, Marty's Eats, which just got their permission today, so they have their permit. And then we have El Toro on River Street, which is the old Dario's. Dario's on Main Street's coming, and then there are a couple others in the works.
Super. Any questions that anyone has?
Good job, thank you.
I would just ask you, when you said there were 4 complaints a few months ago and now we're down to complaints by whom or about what?
They're usually anonymous. I will say a lot of the times they're kind of ridiculous complaints, complaining about customer service attitude or whatnot. But the sanitary complaints are definitely on the low, in my opinion. When I started back in January, I'd say January, February, March, we got about 4 a month. June, July, we had 2 each month, and then I haven't seen anything yet for this month and last. So.
And the food trucks that you mentioned, do they stay in one place stably, or do they go from event to event?
So they have a contract with the property owners, so they'll stay there, but it doesn't mean they're not going to take a day off and go to a food truck festival in another city, or if they're commissioned for a private party. But for the most part, they are stationed right where they are.
Super. Well, it's wonderful to hear this. I think in the past we've had a little bit more difficulty. I don't know if it had to do with the establishments or just how the inspections were being carried out, but it sounds as if things are going very smoothly. It's wonderful to see all these new restaurants opening up here and giving us more choice about where to go. So thank you very much for all the work you do.
Oh, you're welcome.
Actually, I do have one question. How has it gone with S&S Lobster
As in
in your inspections?
inspections, they've been pretty good.
Okay,
When I go through there, they're very cooperative, open to suggestions.
thank you.
So, and I only do the retail part. They are a wholesale vendor, so the state comes in and does
Right,
half of them. So I only really do half of their establishment.
okay.
Anything else?
And just one other thing then on that. So when you ask for a correction to be made, pretty well it's being done?
Yeah, everyone's inspection list gets shorter and shorter. I'm noticing as I'm going through my second wave. There are some new policies that come up, and there are sometimes I may have missed something in the past. But for the most part, my key focus are temperature control and sanitation. And I'd say throughout the city, everyone's very cooperative, especially on those hot days that we've had. They're very open to suggestions when I say you might need a second backup or you have to start cooling things down, smaller portions, things like that. Everyone seems to be very understanding.
Super. Thanks very much.
Thank you.
Thank you, sir.
Well, I guess we can go on then to the Communicable Disease Division. I had asked just, in addition to having the update on the food inspection, to have kind of an update as to where we might stand with regard to monkeypox, whether we're encountering that at all. And I suppose if you want to speak about that, Victoria, with regard to monkeypox and throw in some COVID information too, that'd be great.
Yeah, definitely. I have a couple of slides for you, so we have some visuals. Let me just plug this in. Uh-oh. Aha, there we go. Okay, so you guys can see that, right? Yeah. All right, so for an update on monkeypox, and just to clarify on the first point here, because there have been under 5 cases in the MPHN, I kept it more general so that the number of cases we have aren't identifiable, just to be respectful of those folks. So we've had under 5 cases in the entire Montechusett Public Health Network, all of which have been Fitchburg residents. There's been a kind of a mix of very mild illness to more on the moderate to severe illness side that did require some outpatient treatment. So that's what we have going on so far. The cases that we did have in Fitchburg, they were 2 weeks ago now, and we haven't had any since. So that addresses the last bullet point I have here. It seems like cautious optimism, but the growth rate of the outbreak, both in the United States and also globally, is starting to decline, likely the result of things like behavior changes of the most impacted population, the vaccination efforts that have been going on since the outbreak started. So again, cautious optimism. We're hoping that the outbreak will continue to progress in the way that it has in the past couple of weeks, but we shall see. Massachusetts, 300 cases overall, and that is as of yesterday. And then where we stand, so kind of what happens, what's the workflow of when these cases come in to us. Originally, the Department of Public Health, the State Department of Public Health, was handling all of them on their own. They were doing the contacts and the cases themselves. And then they asked the local health departments for assistance with the cases, and with the contacts. And then shortly after the week of July 18th, they began asking the local health departments for assistance with the cases. So at this point, it's the responsibility of local health to take on the monkeypox cases and complete the case investigation, just like with many other communicables. So for now, I've been handling those as they come in, and we're also in the process of training our case investigators that we have for COVID. In the case that there is a surge in monkeypox cases and all of a sudden the systems that we have in place are overwhelmed. As of right now, I'm not necessarily expecting to need that, but we would rather have that and have people trained than not have people trained and then have a whole bunch of cases and not know what to do with all of them. So we are working on getting everyone trained up, and this, of course, is not a new disease, but it's a new disease to us, so trying to do that slowly so everyone gets a full understanding of what's happening. And then for outreach to cases, I just wanted to give you guys a general idea of what happens when we call them. So there's a few pieces that are kind of critical to completing that interview in addition to all of the typical questions that you would ask in a case investigation, but testing is a big one for contacts, of course. This is almost like the beginning of COVID. It's very difficult to access testing in many cases. It's very difficult to access treatment, even though there is treatment available. And vaccination, there's vaccine sites at, I believe, 14 places in the state, the closest to Fitchburg being Worcester. So these calls to cases and contacts, while all of them look very different, it's generally very involved in terms of, helping people get access to these things because it's still in the very beginning stages and a lot of clinicians aren't quite familiar with it yet. And we're all learning as we go, just like with COVID. So that is what I have for monkeypox. Do you guys, Sandy? Hi.
The cases that are in Fitchburg, are they any way related to each other or connected to each other?
They were connected, and their exposure for all of them was suspected to be within the United States, but out of state, not in Massachusetts. So, yes, the ones we did have were connected to each other.
And the other question is, am I to understand that your team is doing all the case investigations and not the public health nurse?
That is right.
Okay.
So right now, the under 5 cases we've had in the region, I've done them. And if it becomes necessary, which, like I said, I don't think it is at this point. A couple of weeks ago, we were thinking, oh gosh, we're going to be bombarded with all of these monkeypox cases all of a sudden, and we're going to need more capacity to handle it. And luckily, the outbreak turned in a different direction than I was thinking. So right now I'm handling them, and if we need more hands, then we have folks trained to give us some help.
Thank you.
So if all those cases were related, then the contact tracing must not have been too complex, I gather.
Yeah, so the contact tracing part was relatively simple. The part that was more difficult was treatment when it was required. There is a treatment pathway that was developed by the Department of Public Health that a provider calls the state epidemiology line, and then the state epidemiology line refers the provider to, I believe, the medical director of DPH, and then the medical director of DPH and the provider talk, and then it involves quite a lot of paperwork on the provider's end that makes it quite difficult for smaller offices like we have in Fitchburg to get access to this treatment for their patients. So instead, the patients have to be referred elsewhere to get the treatment, but first we have to find where that is, and also make sure that the doses that wherever we find it aren't already reserved for a patient. So, yeah.
And I'm sorry to bother you with these questions, but
that's okay.
Do you know if these individuals who did develop monkeypox had smallpox vaccinations?
That is a good question, and I don't know the answer to that off the top of my head, but I can certainly find out and let you know.
It's just my understanding, and I'm not in any way an expert on monkeypox, but that the smallpox vaccination is somewhat protective against developing monkeypox.
Yeah.
So it may be that those individuals did not have smallpox vaccinations. As far as the treatments go, my understanding is there are a couple of antiviral medications which have not really been used too much for monkeypox, but have been used for other smallpox and
Yes.
Collegium montichiosum, the other pox viruses that are effective, but they're also fairly toxic from what I understand, and one of them's not even available in this country, so I think it's one medication that has some toxicity. So
Yeah.
I think more and more we're just doing supportive care. Unfortunately, most people don't get hugely ill with this, although
Yeah.
immunocompromised people might.
Yeah, and the treatment, unlike COVID, where there is options for self-referrals for individuals who don't have providers, who aren't able to get in touch with their providers, whatever the situation is, patients can self-refer, and then they will be evaluated by a clinician. But for monkeypox, they have to be evaluated by their PCP, and there's certain criteria to be eligible for the treatment, including if there's lesions located in particular places of the body, if they are immunocompromised, if they have any high-risk conditions, one of them being eczema, which is very common, if the illness is more severe, which we did have that happen with one of our cases. So, yeah, it's really on a kind of case-by-case basis for these investigations, and some are more involved than others. So,
Well, it's really great to have you be doing this, and I think the contact tracing is important too, just to kind of head off the disease from spreading more and more. Let individuals who have it know, and that they should take precautions for a few weeks till any lesions disappear and they're not
Yeah.
contagious. And I think prevention plays a big role in this. So, again, thank you very much for
Yeah.
all the update and for the work that you've done.
absolutely.
Was there another topic to do with the Partnership for Vaccine Equity that you wanted to speak about, or?
Yes. Did you want me to start on that, Steve? Does that work?
Please.
All right. So, the other topic we have on the agenda is the Partnering for Vaccine Equity grant. So this is a NACCHO grant funded by the CDC to support local health departments in identifying and also addressing inequities in adult COVID vaccine coverage, but also influenza vaccine coverage as well. And the MPHN was one of, I believe, 12 or maybe 13 communities or local health departments, collaboratives selected for this grant, which will go from this month. The kickoff for the grant is next week, and it goes until July of 2023. So what this means for us, currently we're involved in a lot of efforts relating to increasing vaccine uptake in Fitchburg and Leominster and all of our surrounding MPHN communities, and this allows us to continue those efforts and also expand upon our efforts specifically to influenza as well. As we know, it's all flu vaccine season, and we've been hearing a whole lot of folks saying, I'm due for a COVID vaccine, but I know I'm due for a flu vaccine in a couple of weeks too, so I'm just going to wait and get them together. So because of that and because of the feedback we've heard from the community and people we've spoken to, it makes sense to do them together, which is exactly what this grant is for, so that's good. Our vaccination rate in Fitchburg right now, it's 64% fully vaccinated. And then the state is 77% fully vaccinated. So we're a bit under the state average. And for our surrounding communities, they range from 60% in Winchendon to 82% in Princeton, and everywhere in between for the other 10 MPHN communities we have. And so what do these vaccine efforts look like? Local partnerships. We couldn't do this without all of our partners in the communities, places of worship, senior centers, senior housing developments in particular. It's of course really important that we make sure we're continuing to support the higher risk folks in these efforts, and that would include senior housing. So we've done quite a few clinics at those types of locations, and also outreach to high risk residents, letting people know that they're due for a vaccine. The guidance is changing all the time, and it is so confusing. The other day, I was looking at the updated CDC guidance, and I had no idea what it was saying. Catherine and I ended up having to talk about it because, as we know, the bivalent was just approved, and the CDC guidance isn't really clear for all of the different scenarios that could be the case. If someone's already received a first booster, are they eligible? If they've already received a second booster, if they've had COVID, all of these things. So it's good for us to be able to walk those folks through and give them a hand where needed. And if they don't need our help, then that's great too. And then just one other thing I wanted to address for this grant is access to vaccination. So I think that there's definitely a perception in the community that vaccines are widely available, and what's the point of doing this if anyone can just go into CVS or Walgreens and get their COVID vaccine whenever they need it. But there are a lot of different layers underneath that can be a barrier to people accessing vaccination, and that's not just the case for COVID. Also flu, like we talked about for the grant, but things like shingles. I know for shingles, when you go to the doctor and you're due for a shingles vaccine, I think in most cases they give you a prescription, and then you got to go to the pharmacy to get your shingles vaccine, and then it's like, I got to schedule it, and I can't figure out the website, and it just becomes really challenging. So I think these issues that we're seeing with COVID are the case for other immunizations as well. So like I mentioned, that can be scheduling. The CVS website is so difficult to navigate, and I have trouble doing it, so I can't imagine some other folks being able to navigate that and schedule their vaccines. Some folks don't have access to that type of technology to get onto those websites. Also, transportation, that's another big issue. I love hosting clinics at the senior centers because typically they have a van that they can bring people. And that just makes it really easy for folks who do not have the transportation or are not able to drive. Right. Language barriers is another issue. I know we talked to a resident a couple of weeks ago that knew she was due for a vaccine, but her primary language was, I believe, Portuguese, and she had some trouble accessing her immunization because of that. So, going out into the community and having staff that speak multiple languages, advertising in multiple languages, makes it easier for these folks. And then convenience, of course. I know for myself, I'm due for a bivalent. It was authorized last week. I could easily go to my pharmacy in my town where I live and go and get bivalent tomorrow, but I have 2 clinics next week that I'm going to be at anyways, and I'm going to get my bivalent there. So that's just, the way it is when it's convenient for people. It's much easier to increase uptake when the vaccine is available in a place that they're going to be anyways. And then the last thing that I mentioned before is unclear and changing guidelines regarding immunization schedules. We see quite a lot. I didn't know I was due for a COVID vaccine, or I wasn't aware that changed. I was actually talking to one of the hospital staff in one of our other surrounding towns to Fitchburg, and this person didn't know about bivalent yet, and she works in a hospital. So it's just really hard for people to catch up, and all of the efforts surrounding this and increasing vaccination addresses these things. So I think that is it for our PAVE grant. Sandy.
So the bivalent is fairly new anyway,
Yeah,
so
very new.
maybe a lot of people just haven't heard about it yet.
Yeah.
I scheduled mine today through
Oh,
Walgreens.
nice.
And I had they're wide open.
Yeah.
There's tons of appointments.
Yeah,
To get
definitely.
both flu and COVID. But I was wondering if you were working in conjunction with, excuse me, our vaccine coordinator that we have in Fitchburg. I hope
Yeah.
that you are. I mean,
Absolutely.
supposed to be doing all this stuff with you, I think.
Yeah, certainly. Yep. We work together in planning all of this stuff. We actually just yesterday or 2 days ago, I think, we're talking about working together to host the yearly flu and now flu COVID clinic at the senior center in Fitchburg. And I would share the date here, but I don't want to do that in case it's not official. So sorry, Kathy. So yeah, no, we certainly do work really closely together. And yeah, I think that addresses your questions,
And
Andy.
one of our former nurses that is an instructor at Fitchburg State reached out to me the other day. She has some students that, did you get that message? She
Yes,
would like them to,
the students are coming
oh,
to.
good, okay, that's,
Yeah, I think Dottie was the one that arranged that. The students are coming to the senior center
okay,
clinic.
thank you.
Do you have any kind of estimate as to how many vaccines you'll be giving out, let's say, of the bivalents? Well, let me back up. Is it just the bivalents that are going to be given now, or are you giving original?
Yeah,
And
so
vaccinations.
just to clarify, so I, of course, don't do any immunizing myself. I am not a nurse or a pharmacist, so I can't do that. But we work with Community Health Connections, and they're great. They have a mobile vaccine team, and they have all of the vaccines available. So if someone goes to a clinic, they can have Pfizer, they can have Moderna. It just makes it very convenient for people to be able to select whatever they need in the moment. But yes, so anyone who is over 12 years old and has received a primary series, so 2 doses of Pfizer, 2 doses of Moderna, and it's been more than 2 months since their last COVID vaccine, regardless of if they have received 1 or 2 boosters, is eligible for a bivalent boost. And it's just 1 boost at this time, of course, and that is it. Anyone who is between 5 years old and 11 years old is eligible for a monovalent boost, which was the original vaccine. Primary series have to be monovalent. So if anyone has not received a primary series yet and is over the age of 6 months old, they are eligible for a primary series with the monovalent vaccine. So bivalent is not authorized for primary series. It has to be the original one. Sorry if that was confusing. That was a lot.
No, it's complex, but I think it's good for us to try to understand it. Well, terrific. So at these clinics, all the vaccines will be available from the
Yes.
original series up to boosters.
Yes,
of
that is
various
correct.
sorts, yeah.
Yeah, 6 months and over, Pfizer and Moderna, and primary series, first dose, second dose, or bivalent booster if over 12 years old.
Right.
Did I get all of that right? And monovalent booster. For 5 to 11. Yeah,
Yeah.
So how to cover it all?
I think that covered it all.
And just going back, you mentioned, I think you said 64% of Fitchburg residents had been fully vaccinated. You're talking about the original series, not boosters, I presume.
That is correct. So fully vaccinated being 2 doses.
Right.
So that would be, as of now, only the monovalent, which is the original vaccine.
Yeah. Do we know how many individuals among those have gotten boosted, or that's probably a difficult...
Yeah, so Fitchburg, and the data is presented a little bit strangely on the state website. So the percentage listed on the Department of Public Health for Fitchburg for 1 booster is 33%, but I believe that includes everyone over 6 months and older, and the 6 months to 4-year-olds are not boosted yet. Many of them have not received their primary series. And the other thing is that, you know, while we do have a metric for who has received a first booster and who has received a second booster, as long as it's been 2 months for both of those groups, you're eligible for a bivalent now. So I imagine that the data dashboard from DPH is going to change to reflect that in some way. I know that's posted on Thursdays, and today is Thursday, so I'd be interested to see if it changes now that it's been a week since bivalent has been released. So, yeah.
Yeah, I think, you know, certainly I think we've all become much more comfortable with COVID being around us, but it's still not a time to let our guard down, especially with new variants coming out, and I would highly encourage individuals to get their boosters and keep up your immunity so that you stay well.
Yeah, certainly. Any other?
I would just like to add that I'd like to thank Victoria as well as the crew, Catherine, and the PAVE grant she wrote in a short notice, and it's $150,000 till the end of the fiscal year, which supports some of the, I know she hates the term, but contact tracers, we call them case investigators, so their duties have changed dramatically since January when they started. They are producing many clinics, I don't know what the amount of clinics are, but they
25.
have done, yeah, it's 25, and now they have several already scheduled for the fall throughout the MPHN communities. So I'd like to thank her for all the hard work.
Thank you.
Ditto that. Thank you.
Thank you. Yeah, I'm happy to learn grant writing. That was a new experience for me, and I'm happy to have this opportunity for the city and all of our surrounding towns. And yeah, like Steve said, I don't like the word contact tracers, because that was certainly very representative 2 years ago when COVID was just starting, and we were calling every case and collecting every contact. I was actually cleaning out my office at home the other day and found some of the protocols that, the original protocols from the CTC, and I saw something that said, the goal is to collect every single contact. And I kind of laughed, because that is most certainly not the goal of reaching out to people anymore. It is way more about the other side of COVID response, connecting people with treatment. We have so many tools in our toolbox now to keep people safe once they are infected, and that includes treatment. And just like with accessing vaccines, there's challenges with accessing treatment as well. So that's a big part of it. Connecting people with vaccination, as you would expect, connecting them with other resources that they need to safely stay home, not just now, but to be safe after they recover as well. So yes, Steve said I don't like the word contact tracers, and that's why I think it gives people a false impression of what to expect when they get a call. So thank you, Steve. I appreciate that.
Yeah, I think we've learned a lot through this pandemic, and it'll help to use those lessons for the future. Certainly, everything hasn't been perfect, but we've had to do the best we can with the knowledge that we've had each step of the way. So, yeah, people change. We've changed the way we've done things. We've changed our minds about certain things, but I'm going to just say I think everyone has acted as best he or she could all along the way in the best interest of the community for everything we've done so far. And again, thank you for all you do.
Thank you, guys. I appreciate it.
Thanks.
Thank you. So I think our next agenda item is the local upgrade.
Local upgrade, yeah. Do you want to go ahead with that then at this point?
I'm going to bring in Paul Grazowitz, who is the engineer for the property located at 726 Ashby State Road.
762.
I'm sorry, 762.
I'm going to
this afternoon.
I'm going to recuse myself from this one because it's a close family member that owns the house. So
Oh, okay.
I'm going to recuse myself.
Fair enough. And I think this has to do with a groundwater offset.
Correct. It's a local upgrade approval, reduction in, well, actually, I'll let Paul, can you hear us?
Yes, hi, good evening, or good afternoon.
Hi.
So, if you wouldn't mind just updating the board, the request, and possibly why we need the request?
We're putting a new system, a replacement, an upgrade in the backyard, more or less where the existing system is. Of course, the new system is, much larger. We went with a Presby, which helped on the square footage. But the existing yard has already a slight mound. So we're putting the system kind of in the high point of the backyard. There's wetlands to the north, so we wanted to get, as far as we could away from that. And you can see right around the north boundary line, there's a little fence and some wetlands. And we've got another fence on to the south side of the drawing. So even though there's an existing mound there now, we're looking for the 2-foot reduction to the bottom of the sand bed, which was recognized by Presby as a reasonable request. Even with that, we're still going to have to mound up that backyard a little bit more. It's not going to ruin it, but putting another foot or two over that whole square footage would definitely ruin that backyard. There's a couple of flower beds back there, and it's a decent usable yard as it is, and as it will be with the reduction in the groundwater offset. Presby recognizes their standard operation in New Hampshire is a 2-foot offset to the bottom of the pipe, not the sand. We're actually got an extra half a foot there, but their DEP approval only lets them go down to a 2-foot offset from the bottom of the sand, which is what we're asking for.
If you were to increase the size of the mound, would that also create drainage problems toward the house, or
it would push water. I mean, currently, it does push water a little bit back towards the house. It would exacerbate that a little bit, and it would have to get it, basically flow around by the septic tank, past the flower bed, to get over towards the wetlands. Water kind of wants to get to the north over there, and the northwest.
From your standpoint, any downsides to our allowing this, or that would?
No, not at all. It's the 2-foot offset. Like I said, when Presby, their state approval, 90% of the systems in New Hampshire are Presby's, and they go to they do their 2-foot offset is standard state approved, and it's to the bottom of the pipe. So there's a lot of history on this, and in their manual and their approval, they would allow a 2-foot offset to the bottom of the sand bed. So I don't see any, basically, I haven't seen many failed Presbys, but when there is a problem with them, they need to get air in them, and they seal. So these 12-inch diameter tubes would fill with biomat, and they need to get air into them and basically recover themselves just by going aerobic. And actually that does work. I have seen, but so it's not a situation where they're going to be. It's a good-sized bed. They're not going to be mounding the groundwater. Standard residential use. I wouldn't. I don't have any hesitation in the 2-foot offset.
Super. Any other questions, or you can't ask any? Ian?
I did have one, though.
Yeah, go ahead.
It may be a stupid question, Paul. Can you hear me all right?
Yes, I can.
Okay, so I'm looking at this design, and I see 2 100-foot well radiuses. Which one is the existing well is the one at the top?
Well, actually, we don't have a well on our lot. There's the city water there.
Oh.
And I'm sure that the neighbors are probably also tied into city water, but there happens to be existing wells that, maybe they use them for irrigation. Maybe they don't use them at all, but we located them and put the radiuses on here in case they are in use.
But they're not actually in use for drinking or anything like that, right?
That, I don't know. We just assumed they were, or they could be.
Okay, all right. Anyway, they do meet the 100-foot,
Yes, yeah, they do.
so, all right. No more from me.
Then I would make a motion that we recommend approval of the Title V local upgrade request for 762 Ashby State Road. And
I will second that motion, and that's to offset the groundwater to the bottom of the leaching field from 4 feet to 2 feet, correct?
right. So I think since we're both in favor, that motion passes.
All set.
Thank you,
All
Paul.
right,
Thanks
thank you very much.
Have a good afternoon. Thank you for your help.
Thanks.
Shall we move on to
We can move on.
number 5? Item number 5 is the Mass Commission Against Discrimination complaint of August 4th, 2022, put forth by Jacqueline Wetchy versus the City of Fitchburg Health Department. I think that, Steve, you had, at our request, made a response to that complaint, and I think you had included it with minutes that you sent.
That's correct.
Yeah.
I also did send it to the board on August 25th for review. I think we just needed to respond within the guidelines of the MCAD, guidelines of MCAD, Discrimination Board. So I did prepare a response. I believe you all commented on it, but we can discuss it if there are questions. But I did prepare a response, and I have forwarded it to the commission so that we were within the timeframes.
Just with respect to that, we have not heard back then from the commission with regard to the response.
That's correct.
I think we have, according to previous.
I believe we have two with MCAD. I don't believe we've had any response from these. The 3 open meeting law
Those are the ones, yeah.
violation complaints, I believe we've received a response from 2 in our favor.
Right. Well, after I read through the response that you wrote, I agreed with it. I didn't see any thing that I would change about it. I don't know, Sandy, if you did or Ian.
No, I didn't see
So
it.
I think we can just let that stand
Let it ride.
and appreciate the good job you did with that.
I did receive some legal assistance on it as well from our Assistant City Solicitor, Donna Pollock, so I wish to thank her for that assistance.
Yeah. I guess I don't, well, these things speak for themselves. I don't really have much to add for it. So I think that would take care of item number 5 then. Number 6 had to do with approval of previous meeting minutes. I think the meeting minutes of June 23rd, 2022 meeting, I think you had also sent to us recently. I think that we had tabled those from our last meeting to now, but I know that they were somewhat lengthy, so I don't know if everyone had a chance to read them in detail, and if we want to go ahead with approving those. Also, I think we wanted to look over and approve, if possible, the meeting minutes of February 17th, 2022, and of October 14th, 2021. So Karen does a wonderful job, so I'm all, I didn't see any troubles.
I'm all set. I'll make a motion to approve the meeting minutes of June 23rd, 2022 as is, if everyone else is okay with
I'll
that.
second that.
Okay.
I'm in favor.
All right. And the other minutes, are they in here in this packet?
So, yes,
They were,
I
yeah.
can help clarify that. We did receive a complaint from Ms. Wetchy that the February 17th, 2022 minutes that were approved by the board identified Deb Wright as a high school principal. Deb Wright is actually the elementary school principal. So I did change, which is on page 19, I did change the written, I did change the title to Deb Wright in the minutes to reflect her actual position. A small repair.
Well, then I would make a motion with that alteration that we approve the minutes of February 17th, 2022, as they stand, corrected.
And I shall second that, and I'd like to thank Mrs. Westgy for finding that error and bringing it to our attention.
And I am in favor.
Okay, so the amendment and approved of the amendment and the meeting minutes of February 17, 2022 are approved. And then on to October 14, 2021, I think there was also another.
So the October 14th, 2021 minutes also identified an error. That change could be found on page 34, if that's helpful. It's in the very last paragraph on page 34. Ms. Wetchy made a complaint of some language, as well as, I don't think it quite said what she said in her written request on an email. However, we did listen to the meeting minutes on FATV, and there were some incorrect terminology used. So in the very last sentence, it says, if the Board of Health imposes this mandate, I think you will have some, and the word was written as leading, but it should have said leaving the public schools, which will allow fewer, and the actual word written was people, and it should say per pupil, reimbursement from the state to cover the fixed overhead costs in our schools, which will have a negative effect on our finances. So two words, leading and people, need to be amended to leaving and per pupil.
I'll make a motion that we approve the corrections to October 14th minutes.
I second that with the amended typos.
Yep. And I'm in favor also of accepting the minutes with the amendments made.
I don't feel there's a significant change in context to that language.
They're
but,
typos, they're not, they don't change the
I
meaning at all.
will send them to wherever she requests them to be sent. I believe she feels that these minutes were sent to various agencies on her complaints, and that they now withhold incorrect minutes. So I will send them to where she insists they should go. But again, I don't think the context really has changed
I agree.
significantly.
Okay. Again, thanks for those corrections. Now, number 7 is to amend the regulations of the Fitchburg landfill permit. It says that a landlord permit owner of a property in the city who does not reside in the city be eligible to purchase an annual permit to dispose at a cost of $50 plus $20 per unit owned in the city. So if I'm understanding, that would allow non-city residents to utilize the landfill?
So that would allow a non-city resident landlord who owns property in the city. Over the years, we had a commercial permit, and that's what these folks would utilize. And basically, they would pay $50 for the permit to the city, and then they would pay the weight of their material, which could be upwards now of $130 a ton, and a minimum of $130 to visit the landfill. Over the years, this commercial permit has basically dissolved, and nobody really utilizes it anymore, which has made very difficult for anybody that owns property in Fitchburg to be eligible to get an annual sticker or a day pass. So we are looking to expand the permit program to a non-resident who owns a piece of property in the city, and that individual we proposed that individual to pay $50 for the permit, as well as $20 for the amount of units in the amount of buildings that they own. And the thought process behind that is we pay about $45 a ton for any trash that is disposed at the landfill drop-off. So basically, it's designed to cover the costs of the disposal of that material. The fees are designed, obviously.
So does this, how does this address the amount that a landlord might bring? I mean, one person might throw away an old TV, another person might have 10
Truckload.
couches. Yeah.
Well, the problem has become that if they do it commercially, they have to pay a minimum of $130, regardless of a truckload or one small item, which has made it difficult for these people to keep their properties clean, and that is, we're trying to make it a little bit easier for these folks to utilize the program with incentive to utilize the program with hopes that it would keep our neighborhoods a bit cleaner.
Gotcha.
And it would hopefully cover costs in the process.
So this would be a yearly kind of one-time fee?
Yeah, I'm thinking it would be a sticker.
So even if they had to pay $200 because they had, 15
Multi-units.
units and, plus $50.
We I felt like the $200 hopefully covers what the city pays in
Right.
disposal costs.
But otherwise, they'd have to pay $130
Every time they go,
right?
right.
So this is a bargain.
It seems a bit of better deal, and it's
I got you.
Yeah.
maybe incentivizes them to utilize it to keep properties clean.
Sounds good to me.
So, motion to approve the amendment to the regulations of the Fitchburg landfill permit, as is item 7 on the agenda, as is. Whatever I just,
And I will second that.
okay,
I'm in favor.
great, all
That
in favor?
passes.
Excellent. So this will have to be posted in the Sentinel, and then I will also have to do a little bit of research on, city council we have a city ordinance that any fees that are put in place need to be reviewed by the council, so the language needs approval from the board, as well as the fee can be established by the board, but I believe the city council may have to approve the fee, but I will look into that as well
Super.
and get that done if necessary.
So, I think that concludes the business that at least is on the agenda. Have we covered everything?
That is correct.
Yep. And there are no remote individuals?
There are no remote individuals. Thank you for asking.
So I think that we may, and we've not taken anyone out of order?
We did not take anybody out of order.
Very good.
Is there an opportunity to ask questions about new business? It's not on the agenda, but can I ask? I just wanted to know what the outcome was with the dogs.
You know, actually, I was going to ask that, so I'm
Yeah,
glad you
I
did.
mean,
yeah.
we had this huge meeting about it, and I want to know what happened to them.
As far as I know, about a month ago, 2 of the animals went to the MSPCA.
Good.
The owner, Mr. Robinson, wanted to keep one. I believe we had an episode. So as far as I know, he was in the works of, wanted to keep it, but didn't want to continue to cause problems. So last I checked, the dog was still with the owner, but had plans on going with the MSPCA.
That
May have
breed of
happened by
dog
now.
is very, very expensive, and, I mean, with the right owner, they could be really good animals.
That's correct.
You know, it's too bad.
So
Too bad.
I will find out if that third dog has in fact moved. It's been a couple of weeks since I've received an update from
Well,
Animal
that's
Control.
good news, though. That's good
Yes.
news.
So no more notification by neighbors of troubles then?
Haven't received any.
Okay, super.
Haven't received any, no.
Bill's always got my back, too.
And our animal control officer was the one that was updating me on what was going on. We did have a couple of incidences shortly after our hearing in June, but seems like them going to the appropriate places and relocating is slowly solving the problem, but I have not received any complaints
Nice job.
recently.
Nice job. So I'll make a motion to adjourn then, unless, John, you want to make it.
I'm in favor, I guess I.
I'm in favor, too.
You got it.
Meeting is adjourned.